Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
What is atrial fibrillation?
Atrial fibrillation is the most common abnormal heart rhythm that we deal with in cardiology. And basically what it means is that the top part of the heart is beating chaotically and irregularly, and it tries to drive the bottom part of your heart, where the real heart rate comes from, to beat also fast and irregularly. Two problems with atrial fibrillation, really. The first problem is that if your heart was to beat fast and uncontrollably for a long period of time, it can get weak. It's like any other muscle in the body, that if it beats too fast and too hard for too long, it will get tired, and it will show up as being tired on an ultrasound, and also with symptoms of shortness of breath and even potentially leg swelling. The other problem with atrial fibrillation, which is actually a little more troublesome for patients, is the ability to develop blood clots in the heart when somebody has AFib. So when somebody has atrial fibrillation, the top part of the heart is trying to squeeze over 300 times a minute. And if you could imagine trying to squeeze something 300 times a minute, it's just impossible to fully empty something 300 times a minute. So what happens is that blood pools in those top chambers of the heart, and when blood pools, blood clots. And if a blood clot were to form in the top part of the heart, that clot could break off and travel. It can go many places, but the one that we worry the most about is to the brain, leading to a stroke.
Tell me what role blood thinners play in treating AFib.
When somebody has atrial fibrillation and they're at risk for developing blood clots, we often thin their blood. And the most common method of doing that is with medications. Now, there's two groups of medications nowadays. There's been the tried and true and tested, which is warfarin or Coumadin, which has been around for many, many years. And then there's all these new medications called targeted anticoagulants that work a little bit differently than warfarin, but also thin the blood essentially in the same way that thins the blood that does not allow blood clots to form in that top part of the heart.
How does a left atrial appendage closed device implant work?
This is something that's been developed for many years, but it's only been FDA approved for about a year and a half. And that is, the concept is this, is that when people have AFib, and I told you they can develop blood clots in the top part of the heart, there's actually a very specific section of the top part of the heart where blood clots form. There's a little pouch or outpocketing of the left atrium, which is one of the top chambers, and blood flows very slow in and out of this pouch that leads to the ability to develop blood clots. So what has happened over time is that left atrial appendage occlusion devices have been developed. And these are devices that are percutaneously, meaning minimally invasively, taken from the groin up to the heart and put over into this appendage, and they basically seal it off so that blood can't flow in and out of it, thereby alleviating the need for long-term blood thinning medications.
And how is this implant impacting patients?
The implant should be painless, right? Other than the initial implant, there may be some soreness in the groin or something like that where the device is inserted. But after that, there should be no symptoms or no side effects from the device itself. Medications, any of the blood thinning medications, all come with a risk of bleeding. You can imagine that if you cut yourself shaving or doing yard work, that you would bleed a heck of a lot more if your blood was thin as opposed to if it wasn't. And sometimes people on blood thinning medication just have spontaneous bleeding, meaning they don't have a reason for bleeding. They didn't get in a car wreck. All of a sudden they just have a nosebleed or they have a bleed up in their brain or somewhere else that can lead to worsening bleeding if they're on these medications. Currently in this country, there's only one left atrial appendage occlusion device that is FDA approved, and that is the device called the Watchman device. And so it looks like this, which is basically like a jellyfish that has these barbs, and what happens is that it's preloaded into a catheter, and it's inserted from the groin through a catheter, minimally invasive, and we put it up to the left atrium, and you basically put it into the left atrium and you unsheath it, meaning you just kind of pull back, and then we do all kinds of tests to make sure that it's stuck and there's no leak around the device. Once we can prove that it's in a nice safe position, we actually let go of the device, and that's it. And then over time, what happens is that the lining of the heart actually grows and seals over the device so that blood can't flow around it or through it. And if blood can't flow around it or through it, blood clots can't form in that left atrial appendage, thereby alleviating the need for anticoagulation or blood thinning medications. And what's been found is that the Watchman device is as good as Coumadin or warfarin in stroke prevention without all the bleeding risk that's associated with Coumadin or warfarin.
How can someone learn more about the Watchman device?
To learn more about the Watchman device and the implantation technique, everything kind of starts with the primary care physician. So as word gets out that this technology and therapy is available to patients, bring it up with your primary care physicians. They may bring it up with you, and then usually the referral process is to somebody here on the Watchman team, which consists of myself, Dr. Kokoris, who's our interventional cardiologist, and then we have an echocardiography team that's led by Dr. Gentile, are the people that basically make sure that we're putting this device in the right spot and that there's no leak around it. So there's a whole team of folks that are working to make sure that this therapy is available to patients.
Can you be a candidate for this procedure if you're on blood thinner medication?
If you have atrial fibrillation and you've been on a blood thinning medication and you have a reason to come off it, either that we just can't get you in a nice kind of regimen with your blood thinning medication, or you're bleeding, or there's a risk of falling, or if you're concerned about somebody on one of these medications that is falling, then certainly those are the folks that we want to see, because those are actually why the device was developed, is to prevent complications from Coumadin or any of the blood thinning medications. The Watchman device isn't for absolutely everybody that has atrial fibrillation that's on a blood thinning medication. The Watchman device is developed for people that are at high risk for bleeding on these medications. So just because you're on Coumadin or a blood thinning medication and you have atrial fibrillation doesn't mean that you're a candidate for the device. However, if you have a reason to come off of it, either you're falling or you're bleeding, or we just can't get it right with medication, then certainly you are a candidate for this device.